Every significant journey, every major challenge, well, it often begins with a difficult start, right? Think about launching a new project, maybe moving, or even just tackling a new workout. It's tough. But that initial struggle, it can really define the path forward. Now imagine that difficult beginning, not for us, but for, well, an entire species right at the very moment of birth. We're talking about something really profound, actually economically significant, and surprisingly common in the animal kingdom. It's the challenging event of a difficult birth in cattle, known as dystocia. Today, we're embarking on a deep dive into this. It's a crucial topic. We're going to extract the most important nuggets of knowledge, uncover some, frankly, surprising facts, and give you a shortcut to understanding what so many in agriculture face daily. This deep dive is really custom-tailored for you, the curious learner, whether you're into cattle, agriculture, or just fascinated by the science behind things. Our mission is simple: make you well-informed on an issue that, well, it affects a billion-dollar industry.
So yeah, to start off, what exactly is dystocia? In its simplest terms, it's just difficult or abnormal labor in cattle. So this means the delivery of the calf is prolonged or it fails altogether. And it's a situation that often demands, prompt intervention to reduce the risk for both the mother, the dam, and the calf.
And when we look at the scale of this problem, it's pretty staggering, isn't it? Dystocia is particularly common in first calf heifers, those young cows having their first calf.
That's right. Studies show incidence rates as high as 10–15% in these heifers. And in some dairy herds, believe it or not, over 50% might require some assistance.
Wow, over 50%.
Yeah, compared to mature cows, where it's typically more like 3–5%.
That's a huge difference, really highlights the vulnerability there.
And it's not just a physical challenge, the economic impact is immense.
Yeah.
Reproductive diseases, including dystocia, they drain an estimated $1 billion nationally from the U.S. cattle industry every year.
$1 billion.
Yeah, and dystocia and infertility alone, they account for about 3/4 of that huge figure. On an individual farm level, a single severe case, well, it can cost anywhere from maybe $145 up to $500.
That adds up fast.
It certainly does. It's a significant financial burden.
And what's really eye-opening, I think, are the hidden costs you mentioned. It goes way beyond just, direct calf losses or vet bills.
Exactly. Dystocia leads to increased days open.
Okay, so longer until the cow breeds back.
Right. Lower conception rates, too, and significantly reduced milk yield. And here's a key difference. The cost per cow is much higher in dairy, around $52.60, compared to beef at maybe $14, largely because of that lost milk.
Oh, yeah.
It also, unfortunately, increases culling rates. So you're removing animals that should be productive.
So the impact just ripples through the herd, affecting long-term productivity, not just a one-off event.
Precisely. It cascades through the herd's future. And connecting this to the bigger picture, it's clear dystocia isn't just an economic issue. It's a profound systemic stressor. It really compromises the immune systems of both the cow and the calf,
Making them more vulnerable.
much more susceptible to secondary infections and diseases.
Yeah.
For calves, this means weakness, maybe delayed nursing, which critically impairs their absorption of colostrum, their first milk, their immune defense.
I like that first protection.
And for the cows, it raises the risk of serious uterine infections, like metritis. This whole cycle of stress and susceptibility, it diminishes their overall productivity and even their survival rates.
Okay, we've really set the stage. It's clear dystocia has this profound impact. So our journey ahead now will guide us through its varied causes, recognizing those crucial signs, understanding interventions, post-birth care, and maybe most importantly, how to prevent it, including some really exciting new advancements, I hear.
Absolutely. Lots to cover.
All right, let's dive in. So now that we understand the sheer scale of this challenge, let's peel back the layers. Why does dystocia happen? It's not a simple thing, is it? It sounds like a complex puzzle. What exactly causes a difficult birth in a cow?
You're absolutely right. It's definitely not simple. Dystocia is what we call a multifactorial condition, meaning it rarely stems from just one single cause. Instead, it's this complex interplay of maternal factors, fetal factors, and management factors, too.
Yeah.
And these often interact in ways you might not expect, so effective prevention really needs a holistic view. We can broadly categorize the causes, though. First, you've got maternal causes. These account for maybe about 14.5% of cases. The most common maternal issue is something called fetopelvic disproportion. Fetopelvic disproportion. Basically, the calf is too large for the cow's birth canal, or sometimes the cow's pelvis is just too small.
Okay.
And this is especially common in those first calf heifers we talked about.
Because they're still growing.
Exactly. Their pelvic canal might not have reached its full mature size yet. They're growing themselves while pregnant. Another significant maternal cause is uterine inertia.
Inertia, like lack of movement.
Pretty much. It's the failure of the uterus to contract effectively, like the engine sputtering out. This can be primary, maybe poor muscle tone, hormonal issues like low calcium, or even stretching from lots of pregnancies. Or it can be secondary, basically, exhaustion from a really long labor, like a muscle cramping up.
Got it.
Then there are less common things. The cervix not dilating properly, the uterus actually twisting uterine torsion, or other physical abnormalities.
So it could be the cow's body isn't quite pushing right, or she's physically too small for the calf. That makes sense. But if maternal issues are only about 14.5%, what about the calf itself? How often is the calf the main issue, and what about it causes trouble?
Right. That brings us to fetal causes, and these account for the vast majority, roughly 85.5% of dystocia cases.
85%. Wow.
Yeah. And the single most common fetal cause, fetal oversize. The calf is just too big. This is directly linked to high birth weight. And interestingly, bull calves usually outweigh heifer calves at birth, which unfortunately means higher rates of difficult births for the male calves. But beyond just size, abnormal fetal positioning is a very frequent cause, a huge chunk of that 85%.
Oh,
This
wow.
includes malpresentation, like the calf is oriented wrong. Think breech, coming backwards, or transverse, lying sideways.
Okay.
Then there's malposition, maybe being upside down, and malposture. This is where a limb or the head is flexed back instead of pointing forward.
Like a leg tucked back.
Exactly. And malposture, especially a flexed limb or deviated head, is actually the single most common fetal cause overall.
Really? More common than just being too big.
In terms of why intervention is needed to correct something, yes, often it's a posture issue, though size contributes heavily too. Other fetal factors can be congenital abnormalities, fetal monsters, sometimes called like hydrocephalus, where the head is swollen with fluid. And fetal death can also cause issues because a dead fetus loses muscle tone and can swell up with gas, making it really hard to get out.
So it's a game of inches and angles, sounds like.
It really is. An oversized calf, or one that's even slightly mispositioned, accounts for the vast majority of difficult births. It tells you where most interventions need to focus.
A big calf, or one that's just not lined up right, that causes most of the trouble. That's a powerful insight, especially the bit about malposture being so common. And then you mentioned management factors. How do they fit in?
Yes, management and environmental factors play a huge role too. They significantly influence the chances of dystocia. Dam age and parity are critical. Those first calf heifers, again, the primiparous paradox.
Right, growing themselves while growing a calf.
Exactly, highly susceptible to that fetopelvic disproportion. Nutritional management and body condition score, or BCS, are absolutely paramount.
BCS. That's like how fat or thin they are.
Sort of, yeah. It's a
Okay.
visual score of their energy reserves. Overfeeding, especially late in pregnancy, can mean oversized calves and fat building up around the pelvis, narrowing the birth canal.
Okay, so too much isn't good.
Right. But conversely, underfeeding means weak dams, weak calves. They lack the strength. The ideal BCS is usually around 5-6 for mature cows, maybe closer to 6 for those first calf heifers. Genetic factors in sire selection are also crucial. You really want to choose bulls known for low birth weights and good calving ease, a PP.
DPDs.
Expected progeny differences. Genetic predictions of how their calves will likely perform for certain traits, like birth weight or ease of calving, essential for heifers.
Gotcha.
Other factors. Lack of exercise can contribute to uterine inertia. Even the year and season, sometimes higher rates in winter. And stress. Minimizing stress, like not moving cows right before they calve, is important too.
So if it's so multifactorial, with all these subtle factors interacting, how do we even know when something is wrong? When is it time to step in? That is the vital question, isn't it? You can't fix it if you don't recognize it. So how do you know? What are the key signs you need to look for? And crucially, when is it time to act? I guess you need to know what normal looks like first.
You're absolutely right. Understanding normal is the baseline. Bovine birth, parturition, typically has 3 stages. Stage I is the cervix dilating. Takes maybe 2-6 hours in mature cows, often longer in heifers. Signs are restlessness, going off feed, maybe seeking isolation, a clear mucus discharge. Pretty subtle sometimes.
Okay.
Stage 2 is the main event. Delivery of the calf. Starts when you see the water bag and visible straining. In mature cows, this can be surprisingly quick, less than 2 hours, often just around 20-30 minutes.
Wow, fast.
Yeah. Heifers take longer, maybe up to 4 hours, but typically around an hour. And stage 3 is delivering the placenta, or afterbirth, usually within 3 hours of the calf. If it's not out by 8-12 hours, it's considered retained. Now, recognizing dystocia, that requires careful observation. Key signs: prolonged labor. If stage I goes over 6 hours with no progress, or if in stage 2 you see straining but no progress after an hour for cows, or maybe 2-3 hours for heifers, that's a red flag. Intervention is likely needed.
So things stalling out.
Exactly. Another obvious sign is abnormal presentation. If you see only one foot or one leg way further out than the other, or maybe just the tail or the head with no legs.
Okay, clearly wrong.
Yes, clear indicators of a problem needing correction.
And are there signs the calf itself is in trouble? Even before it's fully delivered?
Yes, absolutely. You look for signs of fetal distress, things like meconium staining, that's the calf's first poop, it's yellowish-brown. If that appears early, mixed in the fluids, it means the calf was stressed inside. You might also see a swollen tongue on the calf, or notice a lack of reflexes in the parts you can see or reach. And for the dam, signs of distress can include excessive restlessness without settling down, severe bleeding, just obvious fatigue, or sometimes an abnormal posture if there's something like a uterine torsion. This brings us to a really critical principle about timing. When do you actually step in? We use the principle time is tissue.
Time is tissue.
Put simply, the longer the labor goes on, the greater the potential damage. Prolonged labor directly correlates with increased trauma, lack of oxygen, acidosis, and ultimately mortality for both the dam and calf.
Okay, so urgency is key.
Definitely. Intervention is warranted if there's no progress within about an hour after the water bag appears for cows, or maybe 2-3 hours for heifers. Also, if you see an abnormal presentation that you can't correct quickly, say within 15 minutes you need help. And obviously, any sign of calf stress or severe dam distress means act immediately.
Sounds like every second truly counts, almost like an ER situation.
It really can be. This highlights that it's not just about reacting, it's about proactive preparedness.
So what does that time is tissue principle mean practically for the decision someone has to make right then?
Practically, it demands continuous, diligent monitoring, especially for those high-risk animals like heifers. It means having trained personnel available, established protocols knowing who does what and when, and strict hygiene. Using plenty of obstetric lubricant, long protective sleeves, clean tools. It's non-negotiable. You really need a comprehensive plan before calving season starts, outlining when and how to intervene.
Okay, so you've diagnosed dystocia, the clock is ticking. What's next? What are the strategies to actually help the cow and calf, and what are the risks involved with jumping in?
Right. Once dystocia is identified, we generally follow a decision hierarchy, moving from least to most invasive. First option is manual assistance. This is where you try to manipulate the calf, maybe apply some traction, aiming to save both the cow and the calf.
Okay.
If, sadly, the calf is already deceased, the next option might be fetotomy. This prioritizes saving the dam by carefully dissecting the calf inside the uterus to allow removal. It's complex.
Right, focuses on saving the mother.
Exactly. And then as a last resort for really severe cases, there's a cesarean section or C-section, surgical removal. This aims to save both, if possible. Now, while intervention is often life-saving, it is a double-edged sword. You have to be careful. The very act of helping, if not done with precision and care, can cause significant trauma itself.
Like making things worse.
Potentially, yes. For the dam, you could cause vaginal tears, uterine rupture, even nerve damage. For the calf, maybe fractures or internal bleeding. The right move saves a life, but the wrong one, or even the right one done poorly, can cause lasting harm. So operator skill and sticking to best practices are absolutely crucial to minimize these iatrogenic injuries caused by the intervention.
So gentle but firm, and really knowing what you're doing is key. What are the specific techniques for that first step, assisted vaginal delivery?
Okay, the first is manual manipulation and repositioning. This involves skillfully, gently pushing the fetus back into the uterus a bit, repelling it to create space. Space to correct those malpresentations or malpostures, like straightening a deviated head or bringing a flexed leg forward.
Ah, okay. Making room to maneuver.
Exactly. Sometimes an epidural anesthetic for the cow helps stop her straining against you. Then there's controlled traction, using obstetric chains or soft ropes, usually placed above the calf's fetlock joint. The key is controlled. Force should be applied following the natural arc of the birth canal, ideally limited to what maybe 1 or 2 people can apply, pulling steadily.
Not just yanking with a tractor or something.
Absolutely not. Strictly avoid excessive force. That causes terrible damage. You usually apply traction alternately to each leg, mimicking natural birth, and constantly check how progress is being made. Finally, sometimes an episiotomy might be needed, a small surgical cut to enlarge the vaginal opening if soft tissue is the main obstruction. But that needs proper care afterwards.
And when do things escalate? When does surgery become the only option?
When vaginal delivery just isn't feasible or seems too risky for the cow or calf, then surgical interventions come into play. Fetotomy, as I mentioned, involves removing parts of a dead calf within the uterus using specialized instruments. Its primary goal is saving the cow's life. It's a highly skilled procedure, and the risk of infection, contamination for the cow is high, so hygiene is critical. Then there's the cesarean section, the C-section. Surgical delivery through an incision in the cow's flank, into the abdomen and uterus. Indications would be an oversized calf that just won't fit, a cervix that won't dilate, maybe an uncorrectable position, or those severe fetal abnormalities.
Can that be done on the farm?
Often, yes. While it's costly, it can frequently be done safely in the field by a veterinarian. And the prognosis for the dam's recovery is generally good, making it a really valuable option for saving both mother and calf when needed.
And none of this works without the right gear in a super clean environment, right?
Absolutely not. Meticulous hygiene is paramount. It cannot be overstated. The cow's rear end, the perineal region, should be thoroughly washed. The person intervening needs ample obstetric lubricant and long, sterile or clean glove sleeves. All tools, chains, handles must be thoroughly cleaned and sanitized between uses.
So having a kit ready is essential.
Essential. A well-prepared calving kit should have things like a bright headlamp, lots of lubricant, gloves, sanitized chains and handles, maybe a calf puller for that controlled traction, an esophageal feeder for colostrum replacer just in case, and iodine for dipping the calf's navel immediately. Being this prepared really transforms calving from potentially a high-stress emergency into a more controlled, manageable process.
Okay, so the calf is finally delivered. Huge relief, I imagine. But the critical period isn't over yet, is it? What immediate and long-term care do both the cow and calf need after a difficult birth? The ripple effects sound pretty profound.
That's a vital point. The work definitely doesn't stop at delivery. For the dam, there are significant immediate risks. They have a greatly increased chance of developing metritis, that's a severe uterine infection, endometritis, which is inflammation, and retained fetal membranes, the afterbirth not coming out.
You don't just pull those out, right?
No, absolutely not. You should not forcibly remove retained membranes. That can cause more damage. Instead, it's supportive care, maybe antibiotics if needed, to prevent infection as they eventually slough off naturally. There's also the risk of physical trauma from the difficult birth itself, tears, nerve paralysis, sometimes uterine prolapse. Yeah. Pain management is important. Often, NSAIDs, non-steroidal anti-inflammatory drugs are warranted. Dystocia is considered very painful for cattle. Supportive care, like offering warm water with electrolytes, good quality feed nearby, that's also essential, and continued monitoring for uterine disease, appetite, milk yield. And looking longer term for the dam. Cows that experience dystocia, especially if it was due to, say, her pelvic size, they are unfortunately more likely to have trouble again. They also consistently face reduced fertility, more days open before rebreeding, decreased milk yield, and higher culling rates. The impact can really linger.
And for the calf, what does being born under such duress mean for its immediate survival and maybe its future health? I imagine it's a rough start.
It's a very rough start. Immediate critical care is paramount for that calf. Dystocia calves often suffer from hypoxia, lack of oxygen, and acidosis, a buildup of acid in the blood from the stress.
Which affects their ability to function.
Yeah, dramatically. It impairs their ability to stand, to nurse effectively, and crucially, to absorb that vital colostrum. This often leads to failure of passive transfer, meaning their immune system doesn't get the kickstart it needs from mom's antibodies.
But what do you do right away?
Immediately, place them upright on their sternum, their chest, helps their lungs expand fully, clear their airways gently, and it's critical. Do not hang calves upside down or swing them. That actually hinders breathing and can cause injury.
Okay, good tip. No swinging.
No swinging. Stimulate breathing by vigorously rubbing their chest with straw or towels. Another critical aspect, temperature. These calves are much more susceptible to cold stress. They've used up a lot of energy, so keeping them warm and dry, fresh bedding, maybe heat lamps, calf jackets is vital, and colostrum management, absolutely crucial. These calves often absorb less immunoglobulin anyway, so feeding 3-4 liters, that's quarts, basically of high-quality colostrum within the first 1 to 6 hours, is non-negotiable.
By bottle.
Ideally by bottle if they can suckle, but if they're too weak, you use an esophageal tube feeder to get it into them safely. Naval Care 2 immediately dipped the umbilical cord in 7% iodine solution to prevent nasty infections traveling up there. And then, close monitoring for at least 2-3 weeks for any signs of illness, like scours or pneumonia.
So yeah, those ripple effects are significant, affecting the next generation right from day one.
Definitely. Dystocia is linked to higher sickness and death rates before weaning. While studies vary on long-term growth effects, that initial hit to immunity and vigor can set them back significantly, impacting their whole life potential.
Okay, so prevention is always better than cure, right? And that sounds especially true for something as impactful as dystocia. What are the most effective strategies producers can use to actually prevent this? And how is technology maybe changing the game here?
Prevention really requires that fundamental shift towards being proactive. It starts way before calving. First, genetic and breeding strategies are paramount, absolutely crucial. Using bulls with those low birth weight EPDs and favorable calving lease EPDs, especially when breeding heifers.
Making smart matches genetically.
Exactly. And these predictions are getting even better thanks to genomic EBV's estimated breeding values using DNA information for higher accuracy. For the replacement heifers themselves, proper development is key. Aim for them to reach about 65–70% of their mature weight by breeding time, around 14 months. Avoid restricting their nutrition too much late in pregnancy. Pelvic area measurements can also help select heifers or match them with easy calving bulls. Next up, nutritional management and body condition score. We talked about BCS. Maintaining that optimal score of 5–6 for cows, around 6 for heifers throughout pregnancy is vital. It's all about balance. Avoid overfeeding causes big calves, fat deposition. Avoid underfeeding causes weak dams, weak calves.
Finding that sweet spot.
Precisely. And ensuring good calcium balance is also important for strong uterine contractions during labor.
So genetics and nutrition. Those sound like the big levers you can actually pull. If you get those two right, have you won half the battle?
You've certainly hit on a crucial point, the interplay between genetics and nutrition. Those are indeed the most powerful and controllable levers for preventing dystocia. They offer the greatest potential for long-term reduction. Absolutely. Beyond that, pre-calving management and monitoring protocols are still crucial. This means close monitoring, especially as calving approaches ideally every 1–2 hours for heifers, providing a clean, dry, comfortable calving environment, minimizing stress. Some people even use strategic feeding times to try and encourage more daytime calving when help is more likely available.
Interesting.
Yeah, calving heifers a few weeks before the main cow herd also helps concentrate surveillance efforts. And always, always be prepared with that dedicated calving kit and clear written protocols for everyone involved.
Okay, this brings us to what sounds like the really cutting-edge stuff. How is technology actually transforming the ability to predict and prevent dystocia?
This is where it gets really interesting. It's truly moving us from being reactive to being proactive, even predictive. Genomic selection, as I mentioned, has already revolutionized dairy breeding especially. Doubled the rate of genetic gain, improved accuracy for traits like calving ease dramatically, allows much smarter sire selection. And then there are the sensor technologies. This is fascinating. Calving sensors, some are placed vaginally, others attached to the tail. They predict calving by detecting things like increased pressure, temperature changes, or specific tail movements that happen before birth.
Oh, and they tell you.
Yeah. They send mobile alerts to your phone, typically 1–3 hours before calving is expected to start.
That's incredible.
Yeah.
That gives you time.
Huge difference. This early warning can dramatically reduce calf mortality linked to difficult births, studies suggest, by up to 50%, because producers can be there ready to intervene much earlier if needed. You hear names like Partisans, MooCall. They offer 247 monitoring, designed to be pretty hassle-free. Lets producers optimize their time, catch problems they might otherwise miss overnight. And beyond just calving, we're seeing the integration of multiple sensors, activity monitors, temperature sensors, rumination monitors with machine learning algorithms. This is leading to what some are calling virtual cow persons.
Virtual cow persons.
Yeah. Systems that continuously monitor an animal's status, providing dynamic, customized alerts for everything from disease detection to predicting the best time for breeding. It's truly precision livestock farming in action. Other emerging things include using ultrasound more for assessments, hormonal therapies, definitely increased use of pain relief, analgesia, and sedation for better animal welfare during interventions. Even veterinary simulators are getting better, enhancing training for complex procedures in a safe environment.
So it's a complete shift.
Yeah.
From reacting to predicting.
Exactly. A highly predictive, proactive approach to cattle management.
Wow. From choosing the right genetics all the way to AI-powered sensors predicting birth. That proactive shift is undeniable. So to kind of recap our deep dive here, we've seen dystocia is this complex, multifactorial challenge in cattle. Significant economic impacts, significant welfare impacts. It's common, especially in those first calf heifers. And its costs, well, they ripple far beyond the immediate event, affecting the whole herd's long-term productivity and bottom line. We've learned that principal time is tissue is absolutely paramount. The longer the labor, the greater the potential damage. Prompt, skilled intervention is critical for better outcomes for both the mother and the calf.
Absolutely.
And the shift is clearly towards these proactive, data-driven approaches through better genetic selection, meticulous nutrition, and now these really cutting-edge sensor technologies. So you listening are now truly well-informed on an issue that impacts a billion-dollar industry and really the foundation of agricultural productivity. This deep dive into cattle dystocia, it really shows how scientific understanding, careful management, and this cutting-edge tech are all converging to tackle complex challenges in agriculture. It makes you wonder, how might these very same principles, understanding root causes, proactive monitoring, tailored interventions, leveraging data, how might they apply to other complex systems or challenges you face in your own life, your own work, turning those difficult beginnings into smoother outcomes? Something to think about.